overall and how we've tracked that over time, and then what that also looks like in contrast with Indiana. And so we kind of tried to keep track of these estimates. The most recent ones aren't shown on here yet, but for the US, the trajectory right now is actually kind of increasing. So here for 2022, it was around 13, but the most recent ones in 2023 are estimated at almost 14. It's like 13.5%, I think, for households that are food insecure. And then for Indiana, you can see here our trend lines kind of mirror what the US is, but like maybe um, a little bit earlier. We're going into our trend line is um, trending up. So, and then below that, you can see the two lines on the top are food insecurity, and then the two lines below, which are yellow and green, are for very low food security. So that's when someone in the household is not eating enough. And those tend to not change quite as much. So when we look at that, at our food insecurity in Indiana compared with other states, we can see that we're similar to the US average. I always think it's like interesting to think about other Midwestern states, and I've highlighted how we see Minnesota here has got one of the lowest prevalences of food insecurity. And so, just I think I'm not really a policy, analyst or person, but just, thinking about what are some of the things that some of these other states are doing that we could be doing could be helpful. So, um, why is food insecurity important for nutrition? Well, we know that, diet is important for a lot of chronic diseases, and it is something that we can potentially modify. It could be really difficult to modify in certain income level situations, but it's potentially a modifier that we have. We can't, change our genetics. We can't change our some other things that are characteristics, but we could potentially change our diet. And we also know that these diet related chronic diseases are impacting people with low incomes and less access to food more prevalently. So this is kind of, the situation, but it's set in the backdrop of the entire US population that has a very poor diet. So I always like to show this slide because I just want to emphasize that, it's not like this situation where only those who don't have enough income have poor diets. It's really all of us. Um, so it's not kind of like a big contrast, even though income does impact diet. It's more like a small difference because we do all um, perform pretty poorly when we compare kind of the general US dietary intake to the goals that we have set forward in the dietary guidelines for Americans. And so this is our kind of overarching nutrition policy in the US. And you might have seen the My Plate logo before that's on the left. It's just kind of reminding us of what's included in the guidelines, which are recommending a variety of the 5 main food groups and limiting saturated fat, sodium, and added sugars. And when we kind of score that like dietary intake as compared with the dietary guidelines on a scale going from like 0 to 100, with 100 as a perfect score, in the US we're generally coming in around a 59. And that hasn't, you can see the scores over time on the left here in orange, that hasn't really changed too much over time. I know these are a bit older at this point from older data, but actually the current look at this from data from 2017 and 18 was exactly the same. So our US diet was scored at 59 again. So this, it's an F plus. It's not amazing. Um, and it's also kind of interesting to think about this in the life course. So we can see that that kind of shown on the right graph, where we tend to have better diet quality when we're very young or older. And we have this kind of dip in quality. Some might not find too surprising for adolescents and young adults having the worst. But this, that there's a lot of federal programs that target these age groups. So, this slide kind of summarizes a lot of the research that we've done. As I mentioned, we do a lot of data analysis, and we're often using national survey data to do that, but we also collect our own data, sometimes from local Indiana samples. Sometimes we had a prior USDA study that included 6 Midwestern states, so we could get a more generalized look at the Midwest. And then we've focused on some other samples as well. But when we look at kind of like, so what does diet quality look like when we consider food insecurity? We actually see that, as I mentioned, all kids have very low quality diets. And as a summary, they're not getting enough vegetables, whole grains, seafood, and plant proteins, and too much sodium. So that's kind of like derived from a lot of studies and summarized. And then we also see many children don't meet the adequacy markers, which it's not the recommendation, it's like what's adequate for several nutrients. And some of them are quite high, like almost 90% are not meeting adequacy for vitamin D, almost 60% for vitamin E, K, choline, more than 30% for calcium, and 20% for vitamins A, C, and magnesium. And again, that's across the board pretty much. But then when we look at just food insecure groups, we see that there is up to 14% more of those groups that also are not meeting adequacy markers for nutrients. So food insecurity tends to make a bigger difference for nutrients and for finding differences there than it does for food groups. It's difficult. You can see on the right here where we looked at food secure and food insecure kids. Their diet quality score, which again, the top score is 100, it was the same. And so food insecurity didn't really make a difference there in what their scores were. But when we looked at nutrients, we could see there were difference in meeting adequacy. When we look at adults, we see some more differences. So again, everybody has low quality diets, not enough vegetables, whole grains, too much sodium, and empty calories. But then when we look among food insecure and food secure groups that are low income, we saw some differences there, and diet quality was extremely low. You can see plotted in the right in green, 46 for the food secure average, 41 for the food insecure average, and then more nutrient inadequacy for a lot of the same nutrients we saw for kids. And then these differences in nutrient adequacy were also similar, around 17% more for food insecure adults. So, kind of in summary, we do have a lot of dietary issues in the US, and those are kind of compounded for those who are low income and food insecure. And we have some interventions to that. Of course, the SNAP, the Supplemental Nutrition Assistance Program, is really an important part of keeping people food, of keeping those estimates even where they are. Like if we didn't have SNAP, they would be even worse. But there's still these dietary gaps. And a component of SNAP is this SNAP education program that Blake is going to tell you more about. But this program is available in all of the states in the US, and it provides nutrition education and budgeting to households that qualify for SNAP. And so we've been very interested in looking at how this program might be working to improve food security. And we've carried out several randomized controlled trials to evaluate this program. One of our first trials, we found that this program improved food security by 25% from baseline when we followed up with the intervention group after 1 year. And so we thought that's really amazing because it's just education to one adult in the household, and it's improving the food security for the whole household. And that was irregardless of whether they were in like WIC or SNAP or other programs. So it's it's definitely seems to be a piece of the solution. We wanted to understand that more. So we also, in our next trial, we evaluated diet. Here we found there wasn't a change in adult diet quality or intake from some of those food groups, but we did see an increase in vitamin D, which was good. But then we were thinking like, well, maybe we're really missing part of the impact of SNAP Ed, because in food insecure households, we know that often the adults will save when they can get more food or higher quality food, they'll save it for kids. So maybe that's why we're not seeing this effect in the adults, because we're maybe not measuring the right person. So we thought we should be measuring at least one kid and one adult in the household. And so that's what we're doing now. We're carrying out another randomized controlled trial to try to quantify that and try to better understand how food insecurity and how diet quality might look over time for people who are in this educational program. And then we also have a goal of making some supplementary lessons that are just focused on food insecure households to really help them improve their food security. And so I don't know what my time is. I can make this fast. Does someone know?
I would say about 3 to 5 more minutes. You're good.
Okay, perfect. So I'll just tell you a little bit about this project that we're working on now. It's another randomized controlled trial. So and this is focused on Indiana households. And they have to have a child that's ages 5 to 18 in their household. And so we recruit them, and then we randomize them to either get the SNAP Ed lessons or not. And then we follow them over time. And so as I mentioned, our eligibility are, eligible to receive SNAP and having a kid in the household, English speaking, but we're recently working to expand that to also Spanish speaking. And we want them to be willing to, stay engaged in the study. We are excluding those who are pregnant or lactating because their diets could be very different, and people who've already been in SNAP. We have these flyers that we're trying to promote, and then we're also in-person recruiting people at local food pantries, and then Blake's team is kind of spreading the word out through all the nutrition education educators. They're sharing this with people who could be interested. And our current progress is we actually have we just reached 100, so this is a little outdated. But we have 100 parent-child pairs that we've recruited, but we're not quite halfway. So we still have a ways to go, but I'm trying to just be very upbeat because yeah, our last semester we had a great increase in recruitment. And yeah, we're trying to get our sample from across Indiana. So we have many counties that are represented so far. And some of the outputs we have, so we already have tried to start analyzing some of our baseline data. And we want to investigate further what diet quality in parents and kids looks like, and if they're related to each other. And then we also want to do some background work to help inform us more for creating those extra SNAP-Ed lessons. So we did a scoping review on the factors that contribute to food insecurity and diet quality in low-income households. And yeah, we haven't been able to address our main evaluation yet of how SNAP-Ed impacts diet quality and food security for kids and their parents. So that is still to come. But yeah, here's some of our pilot work to, it's not our full sample yet, but just to look at diet quality in parents related to kids. We found that it was not strongly correlated, kind of more medium to lightly correlated. So we thought it might be a little stronger than it was, but yeah, there were some components where they were stronger than others. And then here's our publication, our scoping review that we did. So that wraps it up for me, and I will stop sharing.
Thank you so much, Dr. Eicher-Miller. Before we move on, we are going to do a Q&A at the end, but there is one question that I just want to have asked first. Somebody asked if you could share like the flyers for recruitment. Is that possible if you send them to me and I can share them out with the recording?
Yeah, we would love that.
Okay,
we
perfect.
do want to share them, in places where there's more of the population that would qualify for SNAP. And those with kids. But yeah, thank you so much. I'm happy. I'm happy to share that.
Perfect. Yeah. So if you send those over, I can add that. So we will get that shared out and then I will hand it over to Blake.
All righty. Are you seeing my slides?
Yes.
Good deal. All right. Well, good afternoon, everyone. Thank you for having me. And thanks, Heather, for giving that good overview for your research and food insecurity in general. I'm here to discuss the Purdue Extension Nutrition Education Program, which I am happy to serve as Assistant Director for. So first, I am going to jump into what our program is and what our program offers, and then look specifically at some of the programs and projects that we have worked on and currently working on in rural and migrant settings. So if you have not heard of the Purdue Extension Nutrition Education Program, I wanted to mention I do recognize several names here. So hello to my friends that I know. Happy to have lots of new faces that I've not interacted with. So hopefully this is a good introduction to some of you for what the Nutrition Education Program can be and what it can offer throughout the state. And so as Dr. Eicher-Miller mentioned, NEP, as we like to call our program, helps to improve nutrition and health in communities statewide with a lens of specifically looking at our communities and individuals with limited resources. And so we do work with those individuals that qualify for SNAP or other federal food assistance programs. And so we serve all Hoosiers limited resource Hoosiers, youth, teens, adults, seniors, in a variety of different ways. And we have a very defined kind of lens that we program to throughout the state. So based on our funding, which I'll talk about on the next slide here, we focus on these 5 specific areas, which of course play into food insecurity very heavily. So nutrition, food resource management, making sure folks can stretch their dollars throughout the month with their current budget. Food security, of course, having access to those foods, and then food safety, being able to properly prepare and fix the meals for themselves and their families, alongside throwing in physical activity, as that's important for a healthy lifestyle as well. So as Dr. Eicher-Miller mentioned, NEP within Indiana is funded through 2 federal funding streams annually through USDA. So the first one being SNAP Education, the Supplemental Nutrition Assistance Education Division, which is really funded through the same bucket of money that folks receive their SNAP benefits, or formerly known as their food stamps, through. And so we contract annually with the Indiana Department of Health to provide SNAP Ed throughout Indiana through Purdue Extension as the land grant. The second funding stream is the FNEP program, or Expanded Food Nutrition Education Program, which is similar to the goals and mission of SNAP Ed. However, we have a bit of a more defined audience than just limited resource audiences. It is working specifically with youth and adults with children in their home. So similar missions, we at Purdue just kind of umbrella those into one program known as the Nutrition Education Program. But as Dr. Eicher-Miller mentioned, these both are national programs federally, and so these are well known throughout the country. Within our program, we have 2 sets of staff that are working locally within each of their county extension offices and working alongside other county extension educators. The first being our Nutrition Education Program advisors. And these are paraprofessionals that are working to provide evidence-based curriculum and nutrition and physical activity to our SNAP eligible audiences. We'll look a little closer at what that looks like here in a second. And our second staff are what we refer to as community wellness coordinators. And these are professional staff that are working more at a community-based level and lens, hoping to implement and impact policies, systems, and the environment to incorporate and make healthy living and active living opportunities a thing in your areas. So looking a little closer at our direct educators, our NEPAs, as we like to refer to them as, they are providing hands-on direct nutrition education, going into schools, community groups, YMCAs, food pantries, really wherever, working with organizations that, have a similar mission of helping those in need, similar to ours. So, we are teaching how to plan a budget, how to grocery shop and make a list, how to actually prepare or cook certain foods that they might not have ever encountered before. And so the fun part about these activities and these classes is that it's hands-on learning. These folks are up, being active, doing physical activities, but also, learning how to use their knife skills, learning how to use a hot plate, or those things that they might have available to them to prepare a meal for themselves or their family. So along with that, they're also getting to try new foods. So our food demonstrations always are a hit with the kids, trying different flavors of smoothies and just really showing the different ways you can prepare a healthy snack or food item. So these are really exciting, fun, engaging, and might I add, free classes that are available. Currently, we have 4 evidence-based curriculum that they are utilizing, each really with a defined population that they're working with. So our coordinated approach to child health, or CATCH curriculum, is geared towards our younger youth in grades 3 through 8. Our teen cuisine, looking at obviously our teen audiences, mainly in 9 through 12th grades. And then for our adults, we offer Eating Smart and Moving More, for our adults aged 18 through 59. And then our newest curriculum is Eat Smart, Live Strong, which is available for senior audiences aged 60 and plus. And both of our adult curricula are available and can be delivered in both English and Spanish. Our second set of staff that are referred to are CWCs, as you might have heard, or our community wellness coordinators. We like to say they help make the healthy choice the easy choice. So of course, education is important. However, there are components within communities that allow or disallow folks not to be able to make that healthy choice. So we like to say our direct educators are providing that education to show and tell people why eating an apple is important. Our CWCs come alongside them to make that apple accessible to them. So if they can't get to a grocery store to purchase that apple, of course, they can't make that healthy choice. So this set of staff is working more at a policy level, a community level, to increase capacity for these communities to have healthy eating options and physical activity opportunities. So they're focusing more upstream a bit, looking at more of those sustainable community level changes. And they kind of follow a structured kind of process as they are working on these initiatives. So of course, building relationships within the community is important to get to know the community, to establish the needs of the community through a community health needs assessment, and then working with an action team to take those areas of opportunity and build upon those with community change initiatives. So the next few slides, I want to share some of the examples of how we are addressing the areas of food insecurity in some of our rural settings and with some of our migrant populations. And so one of the big ones that are coming to play throughout Indiana, but also nationally, is this concept called food is medicine, or produce prescription programs that you may have referred to it as. But it really is a concept that's recognizing the critical link between nutrition and health, using food-based interventions to prevent and manage and treat diet-related diseases. So this approach really integrates nutrition into the healthcare system, which allows doctors to prescribe healthy foods as part of their medical treatment to these individuals. So food as medicine programs are being integrated into the healthcare systems and community initiatives, which is great to see kind of that shift in healthcare, viewing food really not just as sustenance, but as a powerful tool for improving health and reducing the burden of chronic disease here. So these are just a few of the components that these food as medicine projects entail. Of course, our nutrition education program advisors are coming alongside our community wellness coordinators to provide direct nutrition education program series for the folks participating. They receive food boxes or food to take home to their food and to their families. Obviously, the healthcare partnerships are critical for this linkage and building capacity here. And of course, always keeping in mind culturally relevant approaches for those different projects that we're working on here. Food as medicine really is a multi-level intervention, and really the focus of both our FNEP and SNAP-Ed federal dollars is to increase, collaboration between direct education and more policy systems change. So food as medicine really hits at all of that, all different levels of really the socioeconomic model there. So individual, of course, getting that hands-on knowledge and education through our direct education efforts, working at the community level, collaborating with local organizations and grocery stores to get that food to those individuals. And then at some level, working within policies, within the healthcare settings and your local government to make sure that that access is sustainable also for these folks. A few little quick successes I like to share here, just from some prior program participants. one specifically, I lowered my blood sugar from 276 to 126 thanks to this class and having access to this healthy food. So that in and of itself is a success and a win, just reaching that one person there and making their lifestyle even more healthy. I have a couple links here. If Lindsay's able to share my slides afterwards, you'll be able to easily click that long link there, but a couple other longer success stories that have been written to share the work here related to food as medicine. Another large part of our work revolves around farmers markets. And so we're currently partnering with the Indiana Department of Health on 2 ARPA grants, one specifically looking at Seniors Farmer Market Nutrition Program and one looking at the WIC Farmers Market Nutrition Program. And so that's really just to provide additional access to those healthy fruits and vegetables and produce, and so that they can use those federal kind of dollars that they're receiving locally, and also supporting farmers why we're doing that also. So CWCs really are, very keen on helping with these types of initiatives and increasing access through this. They're working to get SNAP and WIC vouchers accepted, making sure they have the proper equipment for the vendors and market managers to be able to accept that, setting up transportation specifically for our senior audiences to get to and from the markets, working with their local farmers and producers to get them to receive those benefits, and in some cases providing stipends to them for their time and effort. And of course, helping to market the benefits to those that could use them there. So lots of exciting work happening throughout the state regarding farmers markets. Similarly, lots of work happening around the space of community gardens. And so we really like the needs of the community, the wants of the community to speak to the initiatives that we're working on. And we've found that in many cases, there aren't many culturally relevant foods to a lot of our migrants. And so I'm just sharing one example of many that we've worked on here. The Chin Trading Garden here is on actually the south side of Marion County that has been developed specifically for the Burmese refugees. And so they went full force into direct education, actually planting these gardens. We have created growing guides to help educate them. We've offered translation services in the gardens and through our educational materials for them so that they can understand how maybe the climate that they're accustomed to is different here in Indiana, and really teaching and showing them how and when to plant and harvest foods that they prefer. And so a couple photos here showing some things that were grown in that garden this past year: bitter melon, samtok plant, and sour leaf. How's my time looking? I think we're getting there. A couple more slides. Alrighty. Additionally, we have done some work with migrant farm workers. Of course, they traditionally have low wages, which of course means they might have also limited access to resources such as transportation, culturally appropriate foods, and food assistance programs. And so we have partnered with other groups such as Proteus and Catholic Charities to help develop some initiatives to get to those folks and go to them where they are. And so this is an example that we have partnered with in Lake, LaPorte, and Stark counties to deliver food boxes and other essential kind of items to these local farm workers. So of course, these one-time events are great, but we're also looking at more sustainable long-term changes also to implement to assist in these cases long-term. And so looking at acquiring refrigerated trucks for emergency food and storage and transport are things that our staff are assisting their partners with addressing food insecurity with. So as Dr. Eicher-Miller mentioned, we're working with her currently on one study. We are also working with Dr. Cameron Moding from HDFS within HHS here at Purdue on an ag seed project looking at culturally adapting our nutrition education program materials for Latino children and adults, specifically in rural Indiana. So we are looking at investigating their current dietary patterns, their cultural values, acculturation, food availability, and looking at how we can adapt our current curriculum that we're delivering to better meet their needs in that way. So that is just kicking off. Actually, we're in the recruitment phase. So here's one of a screenshot of the flyer that we are working on here. Happy to share that with Lindsay also if you all are in this space that might have adults that identify as Latino or Hispanic that live in rural counties within Indiana and also have children aged 5 through 12 in their homes. So would appreciate if you have any insight as to sharing that for this study also. We're really excited about this one also to help inform, next steps with our programming and how to meet the needs of these audiences. Of course, if you haven't heard me say this yet, we of course can't do any of this work that we do without lots of local partnerships and even statewide partnerships. So this is just a quick snippet of the types of partners that both of our staff are working with. And so if you'd like to get involved, we have our website called eatgathergo.org. Has lots of recipes and resources and educational components, but also a way for you to connect and interact with our staff locally should you have the need there. So of course, always looking to expand our reach and audience for programming for direct ed, but also impacting larger communities as well. So I'd love to connect with you if this sparked any interest of partnership or anything. Again, you can find my email here, find me online at eatgathergo.org. And also would love to have you connect to our social pages. We also share lots of good information there that might be usable for any of the groups you're working with also. I'm ready. I know that was a lot in a short amount of time. Happy to take questions.
That was great. Thank you. And like you mentioned through your presentation, anything you both share with me, I will share out in the follow-up email. So I'm happy to take anything you all have. Yeah. Anybody have any questions? One question I did have for you, Blake, and you kind of touched on it at the end. One for connections, is that just an email through the email that you provided? You're shaking your head. Yes. Okay. And
Yeah,
then my
that'd be
second.
great. I'm happy to be a first point of contact. And then if I need to connect you with specific county staff or we have regional directors that serve as supervisors for these staff, they're also great contacts to begin conversations also for partnering.
Perfect. And then you also talked a little bit about resources and things. Is there, and you might have mentioned this, availability for if someone wants to look at the curriculum you were talking about? Is that available online for people to have access to?
Yeah, the actual curriculum is not available to the public.
Okay.
Kind of, we pay for it through a paywall to provide it through the group that created it. But we do have just some quick descriptions on our website that gives you an idea of how many lessons within each curriculum is preferred and what those lessons entail.
Perfect. Thank you. Any questions? I had like pre-questions, but you all answered a lot of them too. No one? Randy just put a comment in there saying thank you to both of you. All right. Well, I will be adding their contact information in if they're both okay with that to the follow-up email. That way, if you do have any questions after this, you have contacts. Oh, we have one. Is there any work being done to diversify the food options available through food pantries?
I could maybe speak a little bit to that. Um, so, every local food pantry can kind of have its own stuff going on or maybe its own goals. But I am aware that, kind of more nationally, I would say, through Feeding America, which is the network of um, emergency food assistance programs, and also in a lot of the larger um, food pantries, there is a push to try to provide more healthful offerings at food pantries. And there has also been a lot of research work in kind of in that area. And our team too has engaged in some of those studies of just like trying to better understand what the food environment looks like in food pantries, and what, they're doing a lot, but maybe we could use what they do to do even more. And like you mentioned in your question, just try to understand what are some of the dietary components there that are shortfalls that they need more of. Um, in a lot of food pantries, it depends on their kind of physical capacity. Do they have refrigerators? And storage for keeping certain kinds of foods on hand. Um, but in some of our research, we found that food pantries did a pretty good job at providing healthful foods. That's not to say that, there's a lot of different kinds of needs, and some of the things we identified were there should be more foods for infants and young children available in food pantries, also for people with certain health needs like low sodium items, and foods to fit different, we've been talking about the diversity of cultures and growing food in this, in Blake's talk, but also in food pantries, just having um, foods that the population they're serving really wants. So that's another gap that I think this is becoming more aware. There's an awareness growing in food pantries for those things, but yeah, it's a great question.
And I would just add to our community wellness coordinators have some assessments and things that they can use for within food pantries to help them assess, the actual environment of the food pantry and how to make it more accessible to folks, but also to get that feedback from the pantry recipients for what they want and need. All of our community wellness coordinators have been trained and are certified through Leah's Pantry, which is an organization out of California. And so there are resources available through that organization that our staff have access to that they can utilize to kind of help address some of those needs.
Any other questions? And thank you both for that. All right. Well, again, thank you, everyone. Like I mentioned, I will be sending out all of the information after this, a follow-up with slideshows, and then just so everyone's aware, and you probably have gotten the email, we will be hosting another brown bag on February 26th at noon. And the topic of conversation is homelessness. So if you haven't already got that email, we'll be sending another one to register if that's something that interests you. And I hope everyone has a good rest of their day.